Hey ladies, good morning. This is Sandra, TTC 45. I am coming back to explain to you about the placental site nodule that I was diagnosed with. If you guys recall, I had a abnormal pap smear that resulted in me having to have a colposcopy biopsy, and the biopsy results came back showing that I did not have cervical cancer or HPV, which is a blessing. However, I was diagnosed with a rare condition called placenta site nodule, and it is a rare condition that is not often diagnosed, and there's not a lot of information out there. So I dug up some research, of course, from Dr. Google, and kind of compiled this video to let you guys know what this condition is and kind of bring awareness to it. What is a placental site nodule, also known as PSN? PSN is a rare benign lesion of the intermediate trifoblast, which is thought to represent incomplete involution of the placental implantation site. PSN usually represent as menorrhea, intermenstrual bleeding, or abnormal pap smear. What is intermediate trifoblast? The trifoblastic forms an outer layer of the blastocyst in the developing placenta and fetal membrane chorion. In other words, any woman who becomes pregnant, even if the pregnancy ends in a loss or an abortion, she will carry trifoblast cells with a placenta attached or attempted to attach to the walls of the uterus until the baby is delivered or the pregnancy has ended. When the trifoblast cells turns into a tumor, it is now called gestational trifoblastic disease, also known as GTD. What causes trifoblast cells to turn into trifoblastic tumors? The most common cause is a molar pregnancy or remnants of a fetal matter or placenta matter that is left on the walls of the uterus after the placenta attachment site. If all the remnants of the fetal and the placenta is not removed, those trifoblastic cells can turn into a cancerous tumor, also known as GTD. The diagnosis of a GTD is done after hysteroscopic and DNC surgery by scraping out the walls of the uterus and clearing any tissue left behind from a previous pregnancy or loss, and taking a biopsy of the uterus to confirm or deny GTD exists or cancer. In case you don't know what a molar pregnancy is, this is a picture of a molar pregnancy. This is just remnants of tissue with hair attached to it. A molar pregnancy is a non-cancerous tumor that develops in the uterus as a result of a non-viable pregnancy. The pregnancy typically are a result of a sperm fertilizing a blank egg or two sperms fertilizing one egg at the same time. These tumors may or may not be an embryo. Typically, when there's not an embryo involved, they consider that a complete mole or have placenta tissue present. These tumors can have teeth, hair, or bone fragments, or can be a full non-surviving embryo, and they call this a partial mole. What is gestational trifoblastic disease? Gestational trifoblastic disease, also known as GTD, is a group of pregnancy-related conditions that develop inside a woman's uterus. The abnormal cells start in the tissue that will normally become the placenta. It is a group of rare tumors that involve abnormal growth of cells and does not develop from the cells of the uterus like cervical cancer or endometrial cancer do. Instead, these tumors start in the cell that would normally develop into the placenta during pregnancy, and some tumors might have cancer cells within them and some may not. There are several types of GTD, including hydatidform mode and invasive mode, which are complete or partial modes. This happens when a molar tissue is left behind after a molar pregnancy surgery, or the molar grew from the surface of the walls of the uterus into the muscles of the walls of the uterus. The picture I have down in the left-hand corner is a picture of a molar pregnancy. They say it looks just like a sack of grapes. And this pregnancy usually have to be surgically removed, and if it is removed and the tissues from this pregnancy is still left on the surface of the uterus or have grown into the uterine muscle, this can turn into a GTD. Another form of GTD is choriocarcinoma. This develops in women who have a miscarriage, an intentional abortion, or a tubal pregnancy. This type of GTD can grow quickly and spread to the organs away from the uterus. It is mostly found in women who have molar pregnancies, but may be found in women who have healthy pregnancies as well as men. It can be also determined in their testicles, their chest, or either their abdomen. Choriocarcinoma is usually mixed with other types of cancer, forming a type of cancer called a mixed germ cell tumor. Placenta-site trifoblastic tumor is another form of GTD. This is thought to arise from intermediate trifoblastic. It may secrete human placental lactogen, including molar pregnancy, miscarriage, abortion, or full-term normal pregnancy. They can occur several months or even several years afterwards and can result in a false positive pregnancy test. Placenta-site trifoblastic tumors happens after the pregnancy. These tumors develop in the area where the placenta joins the lining of the womb. They can grow into the muscle layer of the womb, and they are also slow growing and are usually curable. Now, I've been diagnosed with PSN, which is placental site nodule, and placental site trifoblasts can result from a placental site nodule if the placental site nodule is not treated properly or cared for in a timely manner. And there's a part I mentioned in here about having false pregnancy tests. Yes, if you take a pregnancy test and you know you're not pregnant, maybe like myself, you know you haven't been sexually active to be pregnant, so you're trying to figure out why are you having a pregnancy test that's showing positive and you know you're not pregnant. That can be a sign of placental site trifoblasts. I did go and buy me a home pregnancy test, and prayerfully that test was negative, so that is a good sign that it's a possibility I may not have this, but again, we're going to pray that all goes well. The last type of GTD I want to discuss is the epithelioid trifoblastic tumor. The epithelioid trifoblastic tumor is an extremely rare type of gestational trifoblastic disease that can be hard to diagnose. Like the placental site trifoblastic tumor, ETT most often occurs after a full-term pregnancy, but it can take several years after that pregnancy before the ETT to occur. Also, like the placental site trifoblastic tumor, ETT does not respond very well to chemotherapy. So the main treatment for this GTD would be surgery. It may have already metastasized when it is diagnosed, which carries a poor prognosis. The treatments for GTD includes a surgery to remove the tumor if the tumor is in one spot and is removable and had not spread it. But if the tumor have spread it or in an advanced stage, of course, the only treatment would be chemotherapy or radiation. If the chemotherapy and radiation is not working, the last resort, of course, will be surgery to remove the uterus, also known as a hysterectomy. And it doesn't matter which treatment you go with, the chances of GTD reoccurring is at least 50%. If you do not be found to have GTD, which I'm praying I do not have GTD, then the only thing I would need to have treated is my placental site nodule. Now, if after the surgery the pathology detects that there's no GTD, the placental site nodule should be cleared with the DNC and no chances of it recurring. You could go back to living a normal life after a PSN has been treated. In conclusion, ladies, I just wanted to make sure you guys knew the signs and the risks of what this rare condition is and be your own advocate. If you recently had a baby, miscarriage, abortion, molar pregnancy, hysterectomy, or any type of pregnancy, whether it ended in a loss or a live baby, just watch for the signs. Some of the signs include heavy bleeding, high levels of HCG when you're not pregnant, severe cramping, nausea, vomiting, headaches, and swellings, uncontrollable high blood pressure, enlarged uterus, and many other signs. Together, we are tougher than cancer. We just got to know our own body, ask the right questions, request for further testing, and if need be, obtain a second opinion. Now, I know they wanted to do a surgery on me to go in and have a hysteroscopic and DNC done to remove any remnants of my pregnancy. However, I've decided that a second opinion will be necessary, so I am waiting on my approval to go into the another OB that's outside of my region and have a second opinion done, and to make sure whatever may be left behind is fully removed, and not trust that my current OB is going to get it removed after giving me so much of a hard time to even test me further. So, okay, ladies, I know I probably gave you a lot of information and you probably didn't understand half of what I was saying, but I didn't want to leave you hanging after that last video. I wanted to give you guys a little bit more of an idea of what this rare condition is. Again, you can go and kind of Google it yourself. You can Google PSN, which is placental site nodule. You can also Google GTD, which is gestational trifoblastic disease. I've also included some resources here if you want to go take a look at it, and you can kind of get an idea of what I'm currently going through. This doesn't mean that I can't have any more kids. This just means that right now, until they determine what is actually going on with me and I get the proper treatment that I have to get, I have to kind of put my transfer on hold until I have gotten a full approval to move forward. So I just wanted to give you guys an update. Thanks for watching. Please click and subscribe if you have not subscribed. Please tell somebody that you know that have been diagnosed with this to take a look at the video and kind of get a peace of mind of what this is. And if you know anybody that is going through any type of issues with abnormal pap smears or abnormal pap smears, so to speak, especially after just giving birth or having some type of pregnancy, refer them to this video. You never know, they can be going through the same thing I'm going through. So thank you, ladies, and I'll talk to you.